Hello, my name is Danielle Hardy. Today we will be discussing how to edit the surgical airway utilizing the LDA avatar. Let's take a closer look. What is wrong in the RT summary? Here we can view that the clinician failed to place the type of surgical airway and the size if it's indicative. Whether this be respiratory, nursing, or other clinical providers, we need to be able to correct this issue. So, how do we correct this issue? First, you need to enter the Doc Flow Sheet tab in your EHR. Then at the very top left-hand corner, click on the LDA avatar. Once the avatar opens, we need to select the surgical airway on the right side of the page and select Properties. The properties for the selected surgical airway are now in view. You need to update or document the airway appropriately, then click Accept that is located further down on the property list. So what if that isn't the issue? What if we need to remove an airway? For example, what if we have multiple airways listed on one particular patient? How do we correct this issue? In this example, note that there are multiple LDAs listed on one patient. We need to clean this up. In this example, we are going to return to our doc flow sheet and click on the LDA avatar. We are now in the LDA avatar. Note that there are two surgical airway icons in this example since we have multiple airways. So we need to select the surgical airway we wish to remove. In this example, I'm going to remove the second one. Typically, most of the time, the reason why this happens is it could be a previous or prior admission. It could be that another provider placed in the surgical airway as well, in addition to respiratory. It could be that no one's ever updated the LDA avatar, but regardless, we need to clean up on what is current in this admission. Our policy for surgical airways and tracheostomy tubes, especially tracheostomy tubes in the adult realm, have to be changed every 30 days. In the pediatric realm, they are changed every 7 days. Once you've selected the surgical airway you desire to be removed, select Remove. This opens the properties to that surgical airway. We need to document a removal date and time, regardless if it's not present on assessment or this admission. Still document the current date and time so the airway will be removed. Scroll further down and accept your documented change. Great job, you've done it. The avatar and the RT summary are now updated. This is the expectation of documentation in regards to surgical airways at ECU Health. Please ensure that you peer check and peer coach others if it is documented incorrectly. We need to all work together to educate one another.